here to check in for physical therapy.
All right, do you have your insurance card today?
Yeah, I do. Here it is.
Perfect, thank you. All right, so I'm gonna be taking you back to go see a therapist. Dr. Faraz,
Yes, Carrie.
your patient Bud is here today to see you.
Oh, hello, Bud. I'm Dr. Frost. I'm the physical therapist. How are you doing today?
I'm doing pretty good, thanks. Dr. Faraz, like Dr. Oz?
Oh, no, not quite. No, I follow evidence-based practice. All right, Bud, let's have a seat here. So what brings you in today?
Okay, so I've been having really random symptoms and they're kind of freaking me out. I don't like it. Sometimes most of the time I have dry mouth, which is really uncomfortable, and I have a really hard time swallowing, which is terrible. And then randomly throughout the day I'll get really tired and dizzy and fatigued and I don't know what to do when that happens. And then all of these other random things are happening. Like I get pain in the middle of my ear and the back of my throat, and sometimes when I'm eating I can't even taste it. It's terrible.
Don't worry, I'm totally familiar with these symptoms. You're in good hands. All right, I'm gonna start examination. All right, I'm gonna palpate your neck. Okay, can you swallow for me? Right, can you have a drink?
Yeah.
Is your mouth dry?
Yes.
Yeah. It's adding up. Can you stand up for me?
Whoa.
Oh, I've got you. Don't worry. Can you please sit down? I'm gonna take your blood pressure, and would you be okay to take your jacket off?
Yeah.
Thank you. All right. I'm gonna take your blood pressure. Okay, you're gonna feel pressure around your arm.
Okay.
Okay. Okay. All right. Just as I thought, your blood pressure is low. Okay. I'm gonna palpate your ear. Is that okay?
Yeah.
All right. Can you feel my hands?
No. Oh my God. Am I okay?
Yeah. You're okay. Which one you would prefer? You want the cherry lollipop or the green apple?
Ooh, I like.
Brandon, can you get me the lollipops, the green apple and cherry? All right, thank you. So, I'm gonna ask you to use these lollipops and use your in front of your tip of your tongue and taste it, and then your middle, and then the behind your tongue, and tell me if you can taste it. Okay?
Okay, can I have the green apple one though?
Of course.
It's better.
Here.
So I just touch this to my tongue to see if I can taste it?
Exactly. So you use up at the front, and then middle, and then back of your tongue.
Okay. Mmm. Oh, it tastes yummy. Oh my God, I can't taste it in the back. What does that mean?
I believe you have the damage to your glossopharyngeal nerve. Okay, most of your symptoms are mild, but the one that concerns me is your blood pressure. So what I'm going to do, I'm going to refer you to a neurospecialist, a colleague and a friend of mine, Dr. Hudson McKinney. She's going to take care of you, and she's going to help you with your symptoms.
Thanks, Doc.
You're welcome. Thanks for coming in.
Damage to the cranial nerve 9, the glossopharyngeal nerve, affects the motor function of the stylopharyngeus muscle, which assists with swallowing. The nerve branch exits the medulla and leaves the cranium through the jugular foramen.
Damage to cranial nerve number 9, the glossopharyngeal nerve, affects the line. Visceral motor, the parotid gland, the largest salivary gland. Its presynaptic nerve exits the medulla, and the postsynaptic exits the otic ganglion.
Damage to cranial nerve 9, the glossopharyngeal nerve, affects the visceral sensory function of the parotid gland, which affects saliva sensation, carotid body, and carotid sinus, which are baroreceptors for blood pressure, and sensation for the pharynx and middle ear. Its nerve branch exits the superior ganglion.
Damage to cranial nerve number 9, the glossopharyngeal nerve, affects spatial sensory of the posterior third of the tongue, which exits the inferior ganglion, as well as somatic sensory of the cutaneous sensation to the external ear.
Glossopharyngeal nerve!